Concern has been raised that some South Africans have jumped the queue to get their first dose of the Pfizer COVID-19 vaccine well before they were due under a system that prioritised first healthcare workers, then people over the age of 60. Some of the queue jumpers are said to have lied, saying they were healthcare workers with potential frontline exposure to the coronavirus. Some exploited loopholes in the sprawling Electronic Vaccination Data System, or EVDS, bypassing an ID number check supposed to ensure those registering are at least 60 years old. To speak now about EVDS and the processes and timeframes involved when a vaccine is released to a country or purchased and what happens thereafter, Dr. Nicholas Crisp is Deputy Director General at the Department of Health and the man in charge of the government's Electronic Vaccination Data System. Thank you so much for making the time to speak to us.
Good evening, thank you, and good evening to the viewers.
Okay, now, so you've heard my introduction. These are valid concerns that have been raised. How do you score the system? Is it running efficiently and transparently as it should?
Yes, we're very happy with the system. It's not just a booking and system that the public sees. There's a huge amount of other functions of what happens within the system for the scheduling, for the management of the sites, for the reporting that we do, for the evaluation and analysis that we do to be able to see which is the next areas to open sites and so forth. And we're very happy with the way in which the system is performing.
But as I mentioned, those concerns, queue jumpers, there's been evidence thereof. We'll talk a little bit more about vaccine supply and demand in just a moment. But what are your comments on that? It is surely something that should concern you.
Yeah, so let's go back to what happened. The system was used for the Sisonke trial, which was focused exclusively on healthcare workers. And during that time, both the professional healthcare workers and other healthcare workers were allowed to register on the system. There was no real definition or clear definition with verifiable requirements during the Sisonke trial. When it came to an end on the evening of the 16th of May, the remaining people who were registered on the system under Sisonke were transferred to the general rollout, and the rest of the system was opened to the public to begin enrolling people on, and we'd already started enrolling people over 60. Some people discovered that they could, who were not professionals, but could allege that they were health workers, discovered that they could register using the health portal. So some 2 weeks ago already, we closed that portal, and I announced at the time that we were working on an alternative solution. And in fact, there are alternative solutions working now, which require a verification process with one of the professional councils before registration into the EVDS for those health workers who haven't yet registered. And there's also a process where we automatically register people who are in the public sector, in the provincial or national health department, directly into the EVDS, and that becomes a verification process as an employee of a provincial department.
So let's talk about supply and demand, the challenges that you're experiencing. I mean, at the moment, South Africa's Johnson & Johnson vaccine rollout is still in limbo because the US Food and Drug Administration postponed its announcement to today, the 7th of June, on whether South Africa can release its Johnson & Johnson vaccines from Aspen's Gqeberha plant. What is the latest on that?
So this is a global problem, and unfortunately we are one of the purchasers of this particular vaccine, so we fall in with all the other countries from around the world who are waiting for Johnson & Johnson vaccine. And we have heard several deadlines of when we will be given a clearance from the FDA. The last we heard was on Friday, when we were told that they had not completed the inspections on Thursday. They were going to continue on Friday, and we might hear on Monday. Today, we are not hearing that that process has happened, but we know that they are busy with the evaluation batch by batch of several batches that may be under some form of suspicion of safety or contamination of some sort. And we don't know when we're going to hear about that outcome of the FDA evaluation.
So you have emphasized that safety comes first, but just please explain to us the processes and the time frames involved when a vaccine is released to a country or purchaser, and how this delay is going to affect us.
Okay, so manufacturing plants make what we call the API, or the active pharmaceutical ingredient. So this is the active biological ingredient for a vaccine, and that's made where we get ours from is manufactured in a plant in the United States in Baltimore, and it is shipped from there in concentrate form to various finish and filling plants around the world, of which we have one at Aspen in Tabeja. So they have a contract with Johnson & Johnson to do what's called finish and fill, or fill and finish. And that is where the labeling and everything happens for the countries where it gets distributed. So the plant in South Africa has prepared vaccines for our country and for a number of other countries for the company that they have a contract with. But that vaccine cannot be released until the parent company that is responsible for the active ingredient says that it is safe. Now, what we understand happened is that there's potential contamination because of the flow of what we call good manufacturing practice within the pharmaceutical plant, and it's a biological plant, so we are even perhaps more concerned than a normal pharmaceutical ingredient plant in the States. And we don't know the extent to which there might have been mixing of different vaccines, or potentially even some contamination. And until that inspection is complete, we won't have any idea what it is they're holding the vaccine for.
Is the time frame dependent on the size of the batch and how many samples need to be taken?
So once our vaccine is released, or in the case of the Pfizer vaccine, when it arrives and it's ready for distribution, it is dependent on what is in that consignment. So if the consignment is a single batch with a few lots, and that's how they divide it up, then samples are removed from the batches and the lots, and they go to the National Control Laboratory for testing. And they also do confirmatory testing on all the cold chain labeling and requirements, the charts that are recorded during the process of the transportation of the vaccine. So if it's a small consignment of one batch with several lots, it could be fairly quick. But if it's several batches and many lots and a large consignment, it obviously takes longer.
Okay, so let's look at the bigger picture going forward. Now, I believe you said that providers say they can double up the 70,000 daily vaccinations very quickly. Have you had any such commitment? Do you expect one? And when would that also be available if that were to be done?
So the provincial administrations and the private sector, who are all the providers of the service, the people who actually see the patients and do the vaccination, have been champing at the bit for weeks now. Since the first week, and we got through the teething problems of everybody understanding the new vaccine and the Pfizer vaccine, we have expected the Johnson & Johnson vaccine to come online into other vaccination sites. But because it's not come online, we've not been able to operationalize fully a half of our total capacity. By now, we should have been at least 140 to 150,000 vaccinations a day. And the provincial administrations and our colleagues in the private sector are confident they would have been able to upscale. And we know from the EVDS and the process we have of registering sites that that is in fact correct. But they are hamstrung by the fact that we don't have vaccine to put into that stream.
Dr. Crisp, I have run out of time, but I just realized there is a very urgent question that I need to know, because I know there are a lot of elderly people, 60 and over, who have not received the SMSs, even though they've registered. So what happens to those who haven't received their SMSs? I know you said you can change location, but what happens if that doesn't work as well?
So what's happened is we have, as of yesterday, 3.3 million people registered on the system, and 1.3 million have received their vaccinations already. So we have 2 million people in queues, virtual queues, waiting for a site. And the more sites we are able to open, the shorter the queues become, because those people can be distributed between the sites. Every night at midnight, we update the new sites and redistribute the queues to make them shorter, and then it's possible to see people sooner. So at the moment, the queues are very long. People need to be patient and wait. We would really not like them to cram into sites and expose themselves to potential infections. You are on the register. We know about you. You will get an SMS. Please be patient.
All right. Thank you so much, Dr. Nicholas Crisp, Deputy Director General at the Department of Health, and also he's the one in charge of government's Electronic Vaccination Data System, or EVDS. We're going to take a quick break. Do stay with us. Hopefully we'll be speaking about vaccination of teachers. Teachers' unions have confirmed that this will go ahead. We'll see what else will come out of that, the numbers that are expected. We're taking a quick break.